Hello, everyone. This is the Ophthalmology Business Podcast, where we help you develop your ideal practice with the help of other doctors and experts. The topics we cover include marketing and management, leadership and recruitment, HR and mindsets, and a lot more. I am Naren Arul Raja, the founder and one of the co-hosts of this podcast. Every listener of this podcast is welcome to join the Ophthalmology Business Academy, www.obacademy.org. The membership is on us, and it's our gift to you. Today, I'm excited to talk to Dr. Omar Shakir, cataract and retina surgeon, clinical instructor at the Yale University, and owner of the Coastal Eye Surgeons. Today, we'll be talking about practice startup and management of a retina surgery office. Dr. Shakir, welcome to the podcast.
Thank you, Naren. It's my pleasure.
Before we jump in, can you tell us a little bit about yourself? Who are you? What's your background? How did you get into ophthalmology? How did you get into medicine? And of course, take us to where you are today. In other words, kind of walk us through your journey.
Sure. Yeah, I love personal stories like that. So it's my honor to share my personal story. So as you mentioned, I am a cataract and retina surgeon, which is a little bit different than what you might hear from a lot of ophthalmologists. I think the assumption is you can do one or either very well, but you can't do both very well. But I feel as though pushing the envelope is my mantra, and I would deem myself a retina refractive surgeon. So not even just a retina surgeon performing vitrectomies and scleral buckling procedures, but also cataract with a serious take on management of astigmatism, multifocal lens implants, doing minimally invasive glaucoma treatments as well. Now, my story getting into ophthalmology it starts with my baseball career, actually. So I grew up playing very competitive baseball in Florida, where I played was a feeder into Division I schools and the minor leagues. And I grew up in my brother's shadow and footsteps, wanting to be a competitive baseball player. And I noticed all of a sudden I couldn't perform as well as I could in the years prior, my junior year of high school. And it took the keen perspective of one of my teammates' dads, who was an optometrist, to say, I think there's something wrong with your vision. You need to come in and have me check it. And I really hadn't had an eye exam prior to that, hadn't worn glasses, nothing. And it was that eye exam that he found a version of foramen frust keratoconus in one of my eyes, which was causing a doubling effect. And it gave me an interesting perspective on medicine in general and ophthalmology and optometric services, which got me interested in research, which then took me to college, where I played college baseball and a leadership in medicine program with a focus on healthcare management. So I kind of switched trajectories a couple of times, going towards healthcare policy, then wanting to do healthcare leadership, and then eventually settling on being an eye surgeon. And thanks to my initial experience during my early baseball career is what directed me towards becoming an eye surgeon. Right.
Now take us from the day you graduated and started practicing as an eye surgeon. What was your journey like? Take us, when did this happen all the way to today?
Yeah, I knew from the start that whatever I chose to do, I'd want to have an ownership and management interest in. Whether it would be solo or part of a group, I wanted to have some commanding force over how I was going to take care of my patient. So going through training and residency as well as fellowship, I still had that interest in learning about the practice management side. And it was during my fellowship at Yale University, with the support of my wonderful attendings and instructors, to make the decision to open up my own practice. And I incorporated, formed my entity and started planning well into my first year as a fellow. And by second year, we were full steam ahead with a lease planned out, a business plan, loans that were secured and ready to go. Literally 3 months after I graduated was when I opened doors.
That's amazing. Like, a lot of people wait, right? They work for somebody else for a while and then they, decide to open up their own practice. So you had the courage to do it right off the bat.
Certainly, it's not for everybody, right? The traditional pathway makes sense, which is you get your feet wet, you start to learn about other things. You've been so tightly focused on training as an ophthalmologist in residency and in fellowship that perhaps you haven't had time to learn about practice management things. And luckily, I did an MBA, so I had chance to learn about the business side of medicine prior to graduating medical school. So this was something that I wouldn't say had experience in, but certainly a little bit of a leg up, and
Right.
then just had a passion for it.
Makes sense. When did you open up your practice? What year was this?
This was 2018, so it's now
Oh,
been
that's
four
great.
years.
That's wonderful. So let's start. What specifically were the greatest challenges when you started your practice? Like looking back, what were some of the things that kind of kept you up at night?
Yeah, this is a question I get a lot from people who are wanting to open up their own practice as well, because everyone knows the challenges that are set forth that are what I call the reasonable challenges, is calculating risk and mitigating that risk with good investments, marketing efforts, and A to Z, everything that goes into seeing patients and making it happen. But what you're not necessarily prepared for is the unreasonable challenges. And I call them unreasonable because they're unexpected and they really shouldn't get in the way of patient care. But that was something I was ill prepared for. I think going through training in residency and interacting with really great teachers, you don't get exposed to the politics of the world. And that's the part that hits you in the face real hard when you come out into practice. Um, Myself, I can tell stories, and if you talk to any solo practitioner, they'll always be willing to tell you stories of the hardships in the first few years. There's a protectionist behavior amongst ophthalmologists. I was blocked out from trying to get on staff at a community hospital, which there was no real good reason for, and I had to push hard in order to get in by just demonstrating that I fulfilled the community standards for being a part of this hospital. As you might know, you need to be credentialed and on staff at a community hospital in order to operate. And essentially, they knew that if I couldn't be on staff, I couldn't operate. And I couldn't fulfill my services to my patients of doing vitrectomies and cataract surgeons, which was my passion. So that was a hurdle to get through. And once I got through and thought this was it, there was then protectionist behavior from other types of entities, not just ophthalmologists, but other practices that try to crowd out the field, I guess, so to speak. And especially now that we're seeing a lot of private equity acquisition in ophthalmology, I think we're going to see more of this type of behavior. That was the toughest part, the greatest challenge of practice. Everything else, I think most ophthalmologists are intelligent individuals that can handle the challenges that are thrown their way, but it's tough when it comes down to politics because it's quite upsetting when you're not prepared for it.
Right. How long did it take you to overcome this first challenge, of getting into the community hospital? Like, was it like long time? Was it a lot of work?
Almost a year.
Almost.
Almost a year. And it was by the compassion of really good physicians on the board of the hospital that said there's no real good reason for this type of block.
Right. So they called it what it is. It was like a block. Yeah,
Yeah, essentially.
makes sense. Now, when somebody is thinking about opening a practice, do most ophthalmologists go in solo or do they go in with like one other partner? Like, what do you see happening right now around you with startups?
I think it's quickly changing, just as I was mentioning about the landscape being private equity acquisition, which, by the way, I don't want to cast any judgment on it. It can be for the better. Certainly, there's a reason why it's happening, and some physicians are making appropriate choices to sell to private equity and have there be conglomeration and acquisition. But I think it's changing rapidly. From my understanding, solo rates are going down. It's becoming more and more difficult to manage a small business, a solo practice with, increasing wages, increasing inflation. Medical inflation is going high, yet for some reason reimbursements go down, right? In medicine, all we see is facility reimbursements go up, but professional services reimbursements go down, which, might sound like a quote unquote, rich physician complaining, but when you're running a small practice, these really affect bottom line. It affects your employment of new hires. It affects your expansion. Affects how you grab and acquire new technologies and implement them. It's tough when you're running a practice on cash flow. If cash flow is interrupted, you have to make new adaptive changes. So I think most physicians who see this happening say, I'd rather just not deal with the headache and go into practice with a partner or partners or a big group. So right now I see a lot of my colleagues going into larger group practices as their initial jumping off point from fellowship or training.
Right. And what percentage do you think, when do you think a typical doctor would start their own practice? And is it after 4 or 5 years? And do you see most of them like doing it alone, or do you think most of them are, doing it with a partner?
Well, certainly it's all over the place. I mean, there are doctors who even open up solo after 30 years of practice. I've seen that happen, and it's really what demands or what wants there are and needs there are on the ophthalmologist side. I think that most people probably follow a trajectory where they go into a group practice setting, gain the confidence that they can deliver effective medical care and surgical care, and then start understanding the billing and financial side of the practice and make a decision probably within the first 5 to 10 years of that runway.
Right. Having done this, what are some of the benefits you see as an owner? Like name the top 3 or top however many like reasons why you like being an owner operator versus a employee at a bigger practice.
Yeah, I think if you're the type who enjoys the creative side of medicine and it's not just a work day where you come in and see patients and go home, when you think outside the box and you think of processes improvements, there's no better way to do it than being an owner or an operator, right? On a daily basis, my mind is turning constantly in between patient care. What can I do better? How can I make this a better experience for my patient? I think most ophthalmologists are tuned to think that way, but they're handicapped by the practice that they may be in, especially if it's a large group practice, because you can't implement change as quickly. So the greatest benefit by far is the manner in which you can take care of your patient and make changes on the fly. If I don't like a certain check-in process because I think it's burdensome and doesn't add value to the patient experience and doesn't add value to the medical experience, I can just cut that out, for instance, or I can adapt to that need and do it in a different way. In a group practice, I don't think I could do that as easily. Same thing goes with technologies. I can implement new OCT technology, new surgical microscope technology, or whatever I might choose to do, or have 3 different types of corneal topography because I want to. And you don't have to justify that to a budgeting committee and go through some approvals process and have a business plan associated with it, or an ROI. I really enjoy that aspect. And then the last is the relationship that you have with all of your staff members, right? So that you can create investment amongst the staff because they work for you, they answer to you, and not that you assume the role of a dictator, but you assume the role of a partner in that way. And when you're employed and everyone's employed next to you, that sometimes you don't have that same type of relationship.
Makes sense. You talked about autonomy. Pretty much that's the theme I got from listening to you, like having control of your own destiny, doing it your way, whether it's with your team, whether it's with technology, whether it's with how you decide to take care of patients or what services you provide. So it's really all about freedom, right? As opposed to your hands are tied and you're told to kind of, you are a cog in the wheel and you just play your part, which is the other side when you're working for a large group practice. If you like autonomy, if you like freedom, then this is a good path to explore as an owner operator. Of course, with freedom comes responsibility, right? You have all these things to fight on your own, and you are kind of, you have to like overcome all these challenges. So it's like a two-edged sword. What are some of the, like looking back, what would you tell a younger self? I know you had an MBA, so you had a leg up, but still you never ran a business before, definitely not an ophthalmology practice before. What would you tell yourself today? Like, here are the 3 things you need to really focus on in the first 3 years.
Of practice or in training or both?
In practice ownership, like as the new owner of a practice?
Yeah, that's a good question. I think your gears change when you come out of training, right? You've been so focused on medical and surgical care of the patient and really becoming an expert on that, because you don't want to have to be learning on the job. You want to come out and provide the excellent quality of care that you know you're capable of day one out of residency or fellowship. So now that you have that confidence, you need to focus on what are the other aspects of a practice. So now that you can provide these services, you have to find patients. So the number one is forming the relationships with referral sources. And the referral source can be your patient. Obviously, the way you treat your patient with love and kindness generates self-referrals from them. But then obviously the traditional referral relationships with primary care physicians and optometrists. So in the first many years, I think building a network, a strong network of, and it has to be genuine, of outreach, giving cell phone number to a PCP or an endocrinologist. For me, for retina, that's huge for diabetic management, and just generally getting your name and your services out there, doing good work, and then marketing in other aspects as well. Making sure you have some type of brand or identity for your practice, and building the marketing side on website management, search engine optimization, Google advertising, things like those. These are skills that you may not have picked up on during your training, and things you're going to have to learn. Those are the biggest challenges, is expanding your repertoire skill set and practice after you've been medically training for so long.
No, it makes total sense. I assume have a retina surgery capability within your office, correct?
Yes, this is something I'm very passionate about, because this is unique. I dare say maybe unique in the world, but definitely unique in the country. Unique for a number of reasons. One is retina surgery traditionally has been done in a hospital setting and then moved to the ASC. As we did less and less general anesthesia in vitrectomy surgery, then you could do it under monitored anesthesia care, MAC, which can be done in an ASC safely. But really, it's not been thought of that you can do this in an office-based setting, or at least do a full suite of services in office-based setting. The thought of doing simple vitrectomies in an office in a very controlled manner has been performed and tested before by my predecessors and people that paved the way. But what's not been done before is being able to offer A through Z in an office. And that means that it removes all barriers to access. We don't have to worry about, really a lot of times I don't have to worry about pre-op physical. I don't have to worry about IV anesthesia. I don't have to worry about block time. I don't have to worry about having access to the technologies in the ASC that I might otherwise want but not have access to. I have all of that here. So I can perform a retinal detachment within minutes of diagnosis, and literally have done that. I've had a patient walk in as a referral with a retinal detachment and had them on the table operating within 30 minutes.
That's wonderful. Do you think the field of retina surgery will transition to fully office-based eventually?
I don't think so. I think that, and I know that's interesting to hear from somebody who's kind of vanguarding the position of pushing office-based surgery. There will always be a place for hospital-based surgery and ASC-based surgery. The reason why is those are way more controlled settings with a skilled anesthesiologist or skilled anesthesia-trained provider. And there are some situations you just can't get around needing that, right? There are going to be challenges on children, on people with tremors or mental disabilities, or extreme high anxiety levels, trauma situations. There's so many, the list is exhaustive of the advantages of being in a hospital or an ASC. But that being said, the other side of this question is, will there be a routine offering in an office? And I don't see why not. Just as cataract surgery is being aggressively taken over by the office because a lot of physicians are seeing the benefits in offering office-based cataract surgery. It's just way more convenient, way better technology. We believe that there's data to support that it's even safer than going in other settings, mainly because the physician has control over sterilization processes, really every process, the prep for surgery, the sterile technique, everything the physician has control over. So there's definite advantages of it. I see the same happening for retina. I don't see why a traditional easy membrane peel or macular hole repair or retinal detachment repair can't happen in an office.
Thank you so much, Dr. Shakir, for joining us today and talking to us about practice startup and management of retina surgery in the office. Before I close, do you have any final thoughts you want to leave our listeners with?
The biggest barrier to it's kind of a common theme, which goes to both sides of what we've discussed, which is office-based surgery and running a practice. The biggest challenge has been, what do we do in a world of decreasing reimbursements? And that is a challenge that we all have to accept together. I think that physicians who choose to work in group settings or be a part of private equity-backed practices still need to feel that charge to support each other in fighting for fair reimbursement. And that means that if medical inflation is going to go up, then the services reimbursements has to go up to at least match, which allows us to do our magic, which is we want to innovate. We want to provide great services for patients. Something such as this, as moving retina surgery into the office, it requires a lot of investment on my part at a loss. A lot of times it requires me to put in my own time, effort, and money in order to make it happen, because Medicare is not at the point yet where they can recognize this, and commercial insurances aren't really there yet. It's too vanguard. So having the support of brothers and sisters in ophthalmology is very important. So advocacy on all levels, I think, should be a part of the profession, and I think everyone should feel that they have to be a part of it.
Thank you, Dr. Shakir. I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, please share it with your friends and on social media. And of course, don't forget to write a review on iTunes and Google Play. Your reviews will help other doctors and practice owners find us. Till we meet again, wishing all of you an amazing week ahead.